The sterile lights of the private wing at Metropolitan Medical Center cast a cold glow over the hospital room as Dr. Elena Hayes reviewed the chart of her most challenging patient. At 32, she had earned a reputation as one of the city's most brilliant cardiac surgeons. But the man lying in the bed before her represented a case that tested not just her medical skills, but her understanding of what it meant to truly heal. Alexander Grant sat upright against the hospital pillows, his bare chest revealing the lean physique of someone who had once taken excellent care of himself. At 38, he had built a technology empire worth $300 million, but 6 months ago, he had received a diagnosis that rendered all his wealth meaningless: advanced heart disease that would require immediate surgery to save his life. "Mr. Grant," Elena said, settling into the chair beside his bed with the quiet confidence that had carried her through thousands of difficult conversations. "I have reviewed your test results, and I need to be direct with you. Without surgical intervention, you have perhaps 2 weeks to live." Alexander's dark eyes met hers with a calmness that she found unsettling. "Dr. Hayes, I appreciate your concern, but I have made my decision. I will not be having the surgery." Elena had encountered stubborn patients before, but this was different. Alexander was not refusing treatment out of fear or ignorance. He was making what appeared to be a deliberate choice to die. "Mr. Grant, I understand that major surgery can be frightening, but the procedure I am recommending has a 90% success rate. You could live a full, healthy life after recovery." "Could I?" Alexander asked, his voice carrying a weariness that had nothing to do with his physical condition. "Dr. Hayes, what exactly would I be living for? I have no family, no close friends, no one who would miss me if I were gone tomorrow. My entire life has been about accumulating wealth and power, and now I find myself asking what any of it was worth." Elena studied his face, seeing something there that her medical training had not prepared her to address. This was not just a man with heart disease. This was a man whose spirit had died long before his body began to fail. "Mr. Grant, depression is common in patients facing serious illness. We can arrange for counseling, medication if necessary." Alexander's laugh held no humor. "You think this is about depression?" "Dr. Hayes, I have spent the past 6 months putting my affairs in order, and I discovered something remarkable. I have 23 employees who depend on me for their livelihoods, but not one person who cares whether I live or die. I have a penthouse, apartment filled with expensive things and an office full of awards, but no photographs of people who matter to me." Elena felt something twist in her chest as she processed his words. She had dedicated her life to saving people, but she had never encountered someone who genuinely did not want to be saved. "Everyone has something worth living for," she said quietly. "Sometimes we just need help remembering what it is." "Do I?" Alexander challenged. "Dr. Hayes, you do not know me. You have no idea what kind of man I have been, what I have sacrificed in pursuit of success. Trust me when I tell you that the world will be no worse off without me." Elena stood up, pacing to the window that overlooked the city below. In all her years of practice, she had never felt so helpless in the face of a patient's pain. Medical school had taught her to heal bodies, but this man's wounds went far deeper than anything she could reach with a scalpel. "Mr. Grant, what if I told you that refusing treatment is not just about you? What if I said that letting you die would haunt me for the rest of my career?" Alexander looked at her with surprise. "Dr. Hayes, you barely know me. Why would my death affect you personally?" Elena turned from the window, making a decision that went against every principle of professional distance she had been taught. "Because I became a doctor to save lives, and I cannot accept that any life is without value. Because in the past hour of talking with you, I have seen intelligence, self-awareness, and a capacity for honesty that most people lack. She moved closer to his bed, her voice gaining strength. And because I suspect that the man who built a company from nothing, who employs 23 people, who has the courage to face death honestly, might also have the courage to face life differently if given another chance. Alexander stared at her, clearly taken aback by her passionate response. Dr. Hayes, what are you suggesting? I am suggesting that you let me save your life and then we figure out together what to do with it, Elena said, sitting back down beside him. I am suggesting that maybe the reason you survived long enough to meet me is because there is still something important you are supposed to do. You would risk your professional reputation on a patient who has explicitly refused treatment? Elena nodded without hesitation. I would risk my career on a patient who needs to understand that his life has value, even if he cannot see it right now. Alexander was quiet for a long moment, studying her face with the careful attention of someone trying to solve a complex puzzle. Dr. Hayes, why do you care so much about saving someone you just met? Because, Elena said simply, I learned a long time ago that sometimes the people who need saving the most are the ones who have convinced themselves they are not worth saving, and because I think you are asking the wrong question. What should I be asking? Not what you have to live for, but what you could live for if you chose to start over. Elena replied. Not what kind of man you have been, but what kind of man you could become if you had a second chance. Alexander looked at this doctor who was willing to risk everything to save a stranger who did not want to be saved, and felt something shift inside him that had been dormant for years. Dr. Hayes, he said slowly, if I agree to this surgery, will you promise me something? What is that? Will you help me figure out how to build a life worth living? Not as my doctor, but as someone who believes it is possible? Elena smiled, feeling tears prick at her eyes. Mr. Grant, I would consider that the most important part of your treatment. 6 months later, Alexander Grant stood in the children's wing of Metropolitan Medical Center, now serving as the hospital's largest donor and volunteer coordinator. The surgery had saved his life, but Elena's faith in his capacity for change had saved his soul. You know, he said to Elena, as they watched children in the cardiac unit playing with toys his foundation had provided, I used to think success meant accumulating things. Now I think it means giving them away to people who need them more. Elena nodded, remembering the dying man who had been convinced his life had no value. Sometimes the most important healing happens not when we save a life, but when we help someone discover what their life is for. Sometimes the greatest medical miracles are not about repairing hearts, but about helping people remember how to use them.